Just as it sounds, flat feet are feet that are flatter than usual because the arches on the feet have fallen or collapsed. When the foot is on the ground, the inner side of the midfoot comes down fully on the floor instead of slightly curving upwards. This condition can also cause the foot to roll inwards towards the inner ankle in a condition known as overpronation. A flat foot is not a deformity or a disorder if it is asymptomatic, show no symptoms. What is a foot arch? The human foot is made up of three parts: the forefoot, the midfoot, and the hindfoot. The forefoot consists of the toes and the metatarsals. The midfoot consists of the bones, muscles, and ligaments that form the arch, while the hindfoot are the ankles and the heel. Under the adult foot is a curve that goes upward even when the foot is bearing the body weight. This upward curve is known as an arch. Two arches are distinct in an adult foot: the transverse and the longitudinal arch, which forms by the joining of the bones in the midfoot and lower leg. The transverse arch runs across the foot while the longitudinal arch runs lengthwise. The foot is well structured and fairly flexible, and this is made possible by 26 bones and over 100 tendons, ligaments, and muscles. Tendons hold these bones together all the way to the heel. These tendons work together to pull up the inner side of the midfoot to create an arch. The tendon actively involved in the formation of the foot arch is the posterior tibial tendon, which runs from the heel bone all the way to the midfoot. The foot arch help in standing, walking, running, and jumping. They make the foot springy and flexible, thus helping it to absorb the shock exerted on the foot by the body weight. It also helps the feet to balance properly and push the body off the ground efficiently. These springy and shock-absorbing attribute of the arch also help to balance the body weight and create a normal gait while in movement. How can you know if you have flat feet? There are diverse ways you can find out if you have fallen arches. They are: 1. Self-diagnosis. You can do this by wetting the foot and standing on a wooden surface or on cardboard paper. If the whole outline of the sole of your foot shows, you might have flat feet. 2. A podiatrist could conduct examinations and make observations to determine if you have flat feet. 3. If your shoes wear out on the inner part of the soles, it is likely to be due to flat feet. What are the causes of flat feet? Flat feet are common in infants and children. It is called flexible flat feet since an arch can be seen when the feet are not bearing weight but becomes fallen when the child stands. A flexible flat foot can become a normal foot when the child grows and matures. Although flat feet are mostly hereditary, there are other conditions that can lead to acquired flat foot in adults. Some of them are: 1. Inflammation or damage of the tendons of the foot, especially the posterior tibial tendon. 2. Bone damage on the foot caused by accidents or injuries. 3. Health conditions that can damage bones and joints such as arthritis. 4. Health conditions that can make the muscles stiff or weak such as muscular dystrophy, Parkinson's disease, and cerebral palsy. 5. Torn or stretched tendons and ligaments due to prolonged wearing of heels and uncomfortable shoes. 6. Weight gain. 7. Large feet. 8. Aging. 9. Health conditions such as high blood pressure, diabetes, obesity, and rheumatoid arthritis. What are the symptoms of flat feet? Most cases of flat feet are asymptomatic, shows no symptoms, and live their lives normally. However, some symptoms that may occur due to flat feet are: 1. Pain in the foot, especially the areas where there may be a torn tendon. 2. Pain in the ankle and heels. 3. Poor shock absorption of the foot can cause pain on the knees, hips, and spine. 4. Stiffness of the foot. What are the effects of flat feet? As flat feet worsen, it affects the gait, which is the way a person walks. The feet also gradually lose their ability to balance the body uprightly and its ability to absorb shock and add spring to the steps. The force exerted on the feet by the body weight is distributed to the knees, hips, and spine, leading to pain in these areas. The change in gait and the pronation, rolling inwards, of the feet can lead to calluses, hammertoes, bunions, plantar fasciitis, inflammation of the plantar fascia, posterior tibial tendinitis, and blisters. How can flat feet be fixed? Wearing comfortable and well-fitted footwear. 2. Foot exercises. 3. Ice compression on painful and swollen areas. 4. Rest. 5. Physical therapy to correct abnormal gait and pronation of the feet. 6. Custom or over-the-counter shoe inserts and orthotic insoles. 7. Walking barefoot. 8. Weight loss. 9. Surgery if necessary. Exercises for flat feet. There are few exercises that can help to build up arches in flat feet. They are: 1. The tiptoe stretch. Stand on the tip of your toes as tall as you possibly can. Raise your heels as far as you can and push down your big toe. Bring down your heels slowly till you are back to the normal standing posture. Repeat up to 12 times. 2. Toe stretches. Place your feet on the floor. Keep other toes on the ground and slowly lift your big toes. Hold them up for 10 seconds. Slowly return the big toes to the ground. Keep the big toes on the ground and lift the other toes. Hold them up for 10 seconds and slowly bring them down. Repeat 10 times. Calf stretches. In a sitting posture, place your feet flat on the ground. Slowly raise your toes and keep the heels firmly on the floor. Keep pointing them upwards towards your body as far as you can. Hold for 10 seconds and return them to the floor. Repeat 10 times. Foot caterpillar. Curl up your feet and try to push the ball of your foot and your toes as close to your heel as possible. Hold for 5 seconds and return your feet to the normal position. Repeat 20 times. Foot arch massage. Place your foot arch on a massage ball. Press your foot down and apply pressure on the ball. Roll your foot over the ball for about 3 minutes. Repeat on the other foot. Do the massage as many times as you can. Achilles stretch. Sit on the floor and stretch your feet before you. Place a massage ball under your Achilles tendon. Press down on the ball. Then roll the tendon on the ball from side to side for 3 minutes. Heel raise. Stand on tiptoe on the edge of a step. Put your legs closer and put a ball in between the ankles. Lower your heels down the edge of the stairs. You will need support to hold. Get back to the tiptoe position and then relax. Repeat 15 times. Orthotics and insoles for flat feet. Insoles or footbeds are materials placed inside footwear to provide a better fit, comfort, and warmth. They can be used to correct foot conditions like flat feet and foot disorders like bunions, heel spurs, claw toes, and plantar fasciitis. Insoles and orthotics are both shoe inserts, but they serve different purposes. Insoles are available for purchase while a podiatrist must prescribe an orthotic, and it is then manufactured with the use of a customized mold. There are 3 main types of orthotics. They are custom orthotics. They are biomechanical insoles that are custom-made to correct pronation of the feet at the ankles and to balance the feet, thereby correcting foot disorders and abnormal gait. They are inserted into shoes, but unlike insoles, they are made with the exact imprint of the foot of the user. Custom orthotics are more effective when worn quite often. They are to replace the insoles originally present in your shoes. Functional orthotics. They are produced with flexible or rigid plastic and graphite materials and are used in correcting foot abnormalities and reduce the incidence of foot pain from physical activities. They are thinner than other types of orthotics and are used to manage the following conditions: arch pain, heel pain, ankle pain, big toe pain, toe joint pain, bursitis, ankle tendinitis and shin splints. Accommodative orthotics. They are produced with soft and flexible foam, rubber, and cork materials to provide optimum cushioning and relieve pressure from swollen and painful areas of the foot. They can also be used to correct foot abnormalities, treat painful calluses, manage foot ulcers caused by diabetes and sore bones. Surgery for flat feet. Flat feet can be corrected by specific foot surgery or a combination of different surgical procedures. This is usually done if the fallen arches are due to bone deformities, inflamed ligaments, and torn tendons. The foot and ankle surgeon make the decision on the best surgical procedure to carry out for the correction of flat feet after carrying out several tests and foot examinations. One or a combination of the following surgical procedures can be used in the treatment of flat feet. 1. Lateral column lengthening. This surgical procedure is used to correct flat feet, especially if the forefoot is extending to one side. The lateral column of the foot is made of 4 sets of bones known as the calcaneus, the cuboid, the 4th metatarsals and the 5th metatarsals joined together in this order from the heel to the midfoot. 2. Medializing calcaneal osteotomy. This procedure is also used to correct foot deformities by realigning the heel bone. Since flat feet is accompanied by the rolling inwards of the ankle, this procedure can be used to correct that. 3. Tendon transfer. This is used in the treatment of posterior tibial tendon dysfunction. It is carried out by transferring the flexor digitorum longus (FDL) to the position of the posterior tibial tendon. The FDL is the tendon responsible for the ability of the 2nd, 3rd, 4th, and 5th toes to curl. The FDL is wrapped around the posterior tibial tendon and they are joined by a stitch. Alternatively, the flexor digitorum tendon can be on the bone where the posterior tibial tendon was attached to originally. Flat feet surgery is usually the last resort in the treatment of flat feet. It is used if the flat feet are rigid and are accompanied by severe pain and discomfort. Did you try out the exercises recommended in this video? Are your arches starting to rise? Tell us about your progress and challenges in the comment section below. If you found this video helpful, click the subscribe button below. Turn the notification on, so you'll know once we post a new video. Do not forget to visit our site, www.zimflatfeet.com for more flat feet content like this. Thank you.